This is a summary of Dr. Anna Lembke, Understanding and Treating Addiction, where we break down the key insights, ideas, and takeaways from this content, giving you the gist so you can decide if you want the rest. In this episode of the Hubermanlab podcast, Dr. Andrew Huberman sits down with Dr. Anna Lembke, a psychiatrist, addiction specialist, and chief of the Addiction Medicine Dual Diagnosis Clinic at Stanford University School of Medicine. Dr. Lembke has dedicated her career to treating individuals struggling with addiction, whether it's drugs, alcohol, gambling, sex, work, social media, or other behavioral addictions. Her research and clinical experience have uncovered the common biological mechanisms that underlie all addictions, as well as effective strategies for treatment and long-term recovery. In this episode, Dr. Lembke and Dr. Huberman explore the neuroscience of addiction, how dopamine, pleasure, and pain are linked, why addiction isn't just about seeking pleasure, but avoiding pain, how modern life has made addiction more common and harder to escape, why behavioral addictions like social media and gaming can be just as harmful as substance addictions, the 30-day dopamine fast, how abstinence can reset your brain, why truth-telling and accountability are critical for recovery, how to support someone struggling with addiction. Dr. Lembke also shares insights from her book, Dopamine Nation, Finding Balance in the Age of Indulgence, where she explains how modern society has created an overabundance of pleasure, leading to a generation more prone to addiction than ever before. 1. What is addiction? More than just a drug problem. A. Addiction is a brain disease, not just a lack of willpower. Dr. Lembke defines addiction as the compulsive use of a substance or behavior despite negative consequences. It's not just about seeking pleasure, it's also about escaping pain. The same brain circuits that make us feel pleasure also process pain. Addiction changes the brain, resetting our ability to experience joy from everyday life. The core of addiction, it rewires the brain's dopamine system, the same system responsible for motivation, learning, and habit formation. B. Addiction can be to anything, not just drugs and alcohol. While most people associate addiction with substances like heroin, alcohol, or nicotine, Lembke explains that behaviors can be just as addictive as drugs. Common behavioral addictions include gambling, sex and pornography, social media and video games, work addiction, yes, this is real, shopping and spending, food, especially processed foods high in sugar, fat, and salt. Key takeaway: addiction isn't about the thing itself, it's about how it affects the brain. The hallmark of addiction is that you keep doing something even when you know it's making your life worse. Not 2. The dopamine system, why pleasure and pain are linked. A. The pleasure-pain balance, why too much pleasure leads to pain. Dr. Lembke explains one of the most important findings in neuroscience. The same parts of the brain that process pleasure also process pain. They work like a balance, or seesaw. When we experience pleasure, the balance tips one way. When we experience pain, the balance tips the other way. But the brain wants balance, homeostasis. The problem: too much pleasure, dopamine spikes, leads to a compensatory crash, dopamine deficit. This is why after a dopamine rush from drugs, social media, gambling, etc., people feel withdrawal, sadness, or a craving for more. The more we chase pleasure, the more we experience pain when that pleasure wears off. B. How addiction hijacks the... At first, using a drug or behavior increases dopamine, making us feel good. But over time, the brain adapts, lowering its baseline dopamine levels. This means that addicts feel worse when not using their drug behavior, leading to compulsive use just to feel normal. The cycle of addiction: 1. Use, dopamine spike, pleasure. 2. Crash, dopamine deficit, craving and withdrawal. 3. Use again, temporary relief, restart the cycle. Over time, addiction is no longer about feeling good, it's about avoiding feeling bad. 3. How to reset your dopamine system, 30-day dopamine fast. A. The 30-day abstinence protocol. Dr. Lembke recommends a 30-day break from an addictive substance or behavior. Why 30 days? The first 10 to 14 days are the hardest. Expect withdrawal symptoms like anxiety, irritability, and depression. By week 3, dopamine levels begin to recover and people start feeling better. After 4 weeks, most people regain their ability to feel pleasure from normal activities. This works for both substances and behaviors, e.g., social media, porn, gaming, etc. The only way to reset the dopamine system is to abstain from the thing that is overstimulating it. 4. The role of truth-telling in recovery. A. Why addicts lie and how honesty heals the brain. Addiction is linked to deception, both to oneself and others. Lying creates stress, shame, and cognitive dissonance, which fuels more addiction. Telling the truth, even about small things, helps restore prefrontal control over dopamine cravings. Neuroscience of honesty. Truth-telling strengthens prefrontal circuits, which helps regulate impulses. 12-step programs like AA emphasize honesty for this reason. It's a core part of rewiring the brain. Recovery requires radical honesty, not just about addiction, but about all aspects of life. Dr. Lembke. 5. Social media and the rise of digital addiction. Social media is engineered to be addictive. Dopamine-driven feedback loops keep users engaged. Excessive social media use is linked to anxiety, depression, and decreased real-world social interactions. Strategies for healthy use. Set strict limits, e.g., no social media after 8 p.m. Remove notifications and track screen time. Take full breaks, weekends, digital detoxes, etc. Addiction isn't about weak willpower. It's about how the brain adapts to excessive dopamine stimulation. Pleasure and pain are linked. The more we chase pleasure, the more we experience pain. Behavioral addictions, social media, work, video games can be just as harmful as drug addictions. A 30-day dopamine fast is the best way to reset the brain's reward system. Truth-telling and accountability are critical for breaking addiction cycles. Recovery is possible, but it requires intentional effort and lifestyle changes. That's it for this summary of Dr. Anna Lembke, Understanding and Treating Addiction. Be sure to follow us wherever you are listening, watching, or reading for more detailed summaries and breakdowns.